You mean to do chelation or remove mercury from the system?
For example.
Yeah. I believe that in subpopulation of children with autism, mercury tightly, very tightly, based on this mechanism of action, binds to tissue proteins. We should be very, very careful that by doing chelation and trying to remove the mercury from the tissue, not to harm these children further, because some of these agents used for chelation also have some side effects. We have to be very careful about that. Now, I know that chelation is very helpful in removing calcium and things like that from the arteries for prevention of cardiovascular disease or improving the clinical conditions with patients with cardiovascular disease. In children with autism, I have seen many cases when they did measure levels of mercury before chelation and after chelation. After chelation, levels went high as tenfold or sometimes higher. That shows that indeed mercury was in the tissue. By doing chelation, removed it from the tissue, and then they detected in the blood or urine and so forth. That by itself shows that the success of chelation therapy if it's done correctly.
So which are the dangerous treatments? What are the dangerous...
I'm not the expert in the field, but again, you know, there some they use DMPS, some they use the MSA, and you should see which one of them are more safe, and only to use the one which are safe. But definitely by removing them, the mercury, from the tissue and release it into the blood, and then from that to urine, that will be the best way to prevent autoimmunity or autoimmune reaction against the metal and tissue as a complex, to prevent immune reaction against that, and probably to reduce the level of autoimmune reaction in children with autism.
Because once the mercury is released from the tissue, the attack of the body against that compound will cease.
Exactly. But it takes sometimes 6 months, sometimes a year, and sometimes longer.
Of continued treatment or before
Of continued treatment, and then before the effect is going to be in place.